Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, Governor Rendell is back at the healthcare business. He's trying to get his coverall Pennsylvanians adopted with a new spending plan, plus our popular Analyst Roundtable after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Joining me, as often is the case, is Pete DeCoursey. He's the Bureau Chief of Capitol Wire, and Fred Anton. He's the President and CEO of the Pennsylvania Manufacturers Association, analysts who join us on a regular basis. Gentlemen, I'll tell you, here we go. We're getting towards the end of the legislative session. Governor has been pressing very hard for his big agenda: energy, health care, open records, maybe not so much his, smoking ban, which he supports. But, Peter, this is all getting hung up. What is going on in the state capitol today is getting hung up, it seems to me, by confusion, and I'm using a mild term here, in the Democratic caucus in the House. Am I right or am I wrong about that?
I think you're dead right. The Democratic caucus has been unable to move on a progressive agenda enunciated by the governor, which they largely support. Fred should be delighted. This is essentially a Republican legislature. Yeah. In the last 6 months, they've done the absolute...
He's not smiling. I noticed Fred hasn't smiled. Go ahead.
This is a classic Republican legislature. They've done the absolute minimum. They've spent the least money they can on new initiatives since the budget passed. They have not moved forward on the bold agenda of the governor, and they've done the absolute minimum. They're going to pass one bill at the last minute this week to make sure that we don't lay off the people who clean up hazardous spills, and they're going to pass 2 more bills to make sure we don't lose $300 million in federal welfare money. Yeah. And they're not going to move on those big agendas. This is a class. The funny thing is, they elected a Democratic House last year, and this has been a less progressive House than the one under John Purcell, the Republican.
One under control. No, Fred, go ahead.
I would agree with that much of Rendell's excessive programs with excessive spending were passed with huge majorities in the huge Republican majorities in the House and Senate. But you notice the 2 top leaders in the Senate and the top leader in the Republican caucus in the House are now no longer in power. They are out. So that was unacceptable to the voters, what was done, or to the caucus. Now, we only are going to say that the legislature's gotten nothing done because the Rendell agenda post-budget passage has been so excessive. The budget exceeded inflation, depending on whose numbers you look at, by a wide margin.
But Fred, let me ask you this question. I mean, here we've got a former member of the House, Frank LaGrotta, indicted. We've got people being called in almost weekly before the grand jury. We've got consternation and I'll use the word turmoil in the legislature, particularly on the House Democratic side. Don't you think that's as important as the spending aspects of the Rendell administration? I mean, that the Democrats don't seem to be able to get their act together?
Well, I think it's certainly a factor, but I think the spending aspects are the spending that Ed Rendell needs to solve some of these fundamental problems. It's grandiose. It's grandiose.
Peter, Fred does have a point. I think this legislature is a little more conservative on with the new members who've been added.
But there's been a classic pattern for 5 years now. When the House passes one of Rendell's plans, grandiose in Fred's term, or in Rendell's term, important and needed by the people, either way, until the House passes it, the Senate doesn't do it. The fact is, the Senate doesn't take up these things until it's forced to by the House. Whether you're talking about transportation, whether you're talking about the tax hike of 2003, it wasn't until John Purcell's House passed a tax hike that the Senate felt, oh, we got to go along, or we got to ameliorate it in some way. So what's happened this year is that except for transportation and some of the budget issues, the House, controlled by Democrats, roiled by these controversies, roiled by this investigation, has been unable to present a united front. They only have 103 to 100 advantage, and as we've seen time and time again in recent weeks, they keep losing a handful of Democrats, and that's all you need to lose. The funny thing, somebody said to me, John Purcell, and Matt Ryan take over the House in 1994. Their last year, after 11 good years where they had a lot of power, 2006, was very much like this year. They said, DeWeese skipped the 11 good years part and gone right to the last year of turmoil.
Let me get this straight and see if I can get some agreement here. We do have Rendell with this hugely ambitious agenda, most ambitious agenda of a second term of any governor I know. Do you agree?
Yeah.
I mean,
more ambitious.
Okay, Fred's right. More ambitious. Then we've got the problem with the so-called bonus gate and the Attorney General's investigations into the more into the House Democratic caucus. So
focus it first, anyway.
Focus it first. So it's a combination of both of those things. Do you agree that have kept the legislature from doing, energy, health care, open records, smoking ban? Go ahead,
And
Fred.
there's one more.
Go ahead.
And there's one more that's more important to the House Democrats, at least one caucus, than all of Rendell's agenda, and that's the crime agenda in Philadelphia.
Okay, we're going to get to that in the next segment, but Fred brings up a great point. All right, we're going to take a break. When we come back, I want to get into it. There was a rally in Harrisburg last week, gun control advocates into the Capitol urging the passage of at least 3 important pieces of legislation. We'll talk about that and more following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're with our analysts, Fred Anton and Pete DeCoursey. All right, Peter, let's go to a big gun rally in Harrisburg. The advocates came to Harrisburg, as they often do. Big point, gun control, 3 important measures. What's that all about?
Right now, there is a huge violence problem. Philadelphia, it looks like, is going to may set another record in murders for this year in gun violence. And so their delegation has been very ginned up on this. The governor made an unprecedented trip to the House Judiciary Committee to testify on gun control.
Weeks ago.
And the problem is that right now there's 130 votes in the House and there's a good 28 to 30 votes in the Senate at least against the biggest of these measures, which would let municipalities make their own anti-gun laws and would limit handgun purchases to 1 gun a month. Now, there's a third provision which would simply require and mandate criminal penalties and other penalties for not reporting lost and stolen handguns. Because what a lot of people do is they'll go buy guns, according to the governor and other gun control advocates, and then sell them to criminals and say, oops, I lost it.
Right.
Now, because it's a crime.
Or they lose them and don't report them, as we would a car.
Yeah, as you would a car or many other kinds of property. Most people, in fact, report their cell phones when they're missing. Yeah. But the fact is that law can probably be finagled into becoming law. They're going to have to give the person who loses a gun more time to report it.
But let me ask you this question. Historically, I mean, you're really Don Quixote if you come up to the Pennsylvania legislature with gun control measures. Am I correct?
You're right.
I mean, the chances, these same measures, 2 of them were voted down in a committee in the State House. Getting it through the legislature is not going to be easy, and yet...
But the point is to get people to vote, because now what happens is, you may remember, Hank Salvatore, a Republican senator from Philadelphia, lost his seat years ago, partly because they ran on KYW 15 times a day, an ad with a nice housewife talking about how she couldn't believe that Hank Salvatore wanted those criminals to be able to easily get guns. Yeah. And they want to be able to run against the suburban Philadelphia Republicans who vote against gun control. And as you saw on those committee votes, some of those suburban Philadelphia Republicans voted for some of these things that they never would have voted before because they were forced to vote.
Certainly right, but the state's a lot bigger than Philadelphia in the suburbs. But let's turn to Fred, something you know something about. You're a Philadelphia guy. Huge issue in Philadelphia. It has all kinds of other implications, this gun control business, doesn't it?
Yes, it does. This murder rate and the crime problem in Philadelphia is by far and away the #1 issue facing the new elected mayor, Michael Nutter. And Michael Nutter...
And the old mayor.
And the old mayor.
And the old mayor. But Michael Nutter, now Michael Nutter is a very idealistic, a very liberal person, and there are very high expectations that he's going to do something about the crime problem. And he's got to do something about the crime problem. Whether he does something about the crime problem by gun regulation, whether he does something about the crime problem by getting black youth. The unemployment rate among young black males is at least 50% in Philadelphia. There are jobs coming up in the huge expansion of our convention center and in the casinos that are likely to be built on Delaware Avenue. There's a substantial question whether unions, largely white unions, will provide minorities with sufficient jobs for young black males. That's another question. John Purcell proposed 10,000 new policemen for the state of Pennsylvania. That is another initiative which might dampen down the
So all of this is, there's a web going on here in a sense, right, Peter?
Absolutely.
I mean, you see this connection between Philadelphia legislators and the governor driving the gun control activity.
And just to be clear, they're not just asking the legislature to be different. As Fred said, Mike Nutter is a pretty liberal guy. Mike Nutter came out in his campaign for stop and frisk, which is essentially racial profiling by cops and demographic profiling by cops. That's not something Michael Nutter did lightly. Philadelphians, as Fred said, are anxious, they are worried, they are obsessed with stopping crime, and so they are not only asking the legislature to do things differently, they are prepared in Philadelphia to do things very differently, and including taking on some of these powerful unions over this minority hiring.
Go ahead.
Yes. Well, this is a problem. When 17 African-American legislators walked out of the legislature and stopped business from being done, that is a dramatic presentation.
Citing this issue.
Citing this issue. That's a dramatic statement of where they view their
so
product.
we got to run, but your point is this is not over. I mean, even though the legislature may not pass the gun control...
The Democratic caucus cannot operate itself without 8 or 10 of those black caucus members, and they've served notice. They will disrupt business.
All right, Fred, Peter gets the last word. All right, when we come back, we're going to do a little health care update. The governor is back at the legislature with a new idea about how to fund the cover-all Pennsylvanians, 800,000 or so Pennsylvanians without health care coverage. The governor is serious about that. We'll find out what the prospects are for the passage of his new effort after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, the governor is back at the health care reform business. He wants to cover 800,000 Pennsylvanians. He had one idea, he's now shifted. Joining me, as often is the case, are two vice presidents, and I want to point out neither of them are running for office. We have Gene Barr, who's with the Chamber, Pennsylvania Chamber. He's Vice President of Government and Public Affairs. And my friend Jim Redmond, who's a vice president, senior vice president with the Hospital Association. Neither of you guys are running for anything. You want to make that announcement?
Absolutely not.
That's right.
Okay, we'll make that announcement. All right, Gene, look, this is pretty important business here. I mean, we're talking about major changes in Pennsylvania's health care. What was the governor's old plan that he obviously can't do? It didn't go anywhere. Talk about that plan.
The governor's original plan, Terry, was to try and get the money's necessary to extend health insurance to many uninsured in Pennsylvania, was that he would do an assessment on all businesses in Pennsylvania.
Right.
And it would be 3% of payroll. Now, if you could demonstrate to the government that the plan that you offered your employees was acceptable, there'd be some mechanism for getting that as a deduction. But the ultimate result is, for many small businesses who really can't afford to extend health care insurance to their employees, would pay a 3% payroll tax, which is an effective doubling of their current rate for small businesses.
Now, that plan, when it was introduced last spring,
never got traction.
I was going to say, I mean, even Democrats, some Democrats were on it, but it didn't get enough support even among...
It really did not.
Yeah.
Really didn't get traction.
All right. Now, Jim, Governor says, okay, that's not going anywhere. Now he has this new idea. Now, it's a little complicated. So our viewers, but you agree with Gene. This is pretty important. We're talking about a potentially huge change in the coverage of Pennsylvanians without health care. Am I right or am I wrong about that?
Oh, that's correct.
This isn't a little deal, is it?
That's correct.
It's a big deal. Go ahead.
And to complicate things, actually the governor came up with 4 different approaches to pay for the health care plan. The one that he favors essentially calls for new taxes on tobacco products and to use some of the monies that were set aside to fund the medical liability costs for physicians.
And we've talked, that's the M-Care fund, I want to get into that. But before I'm going to ask you both quickly. Is the tax on tobacco popular or unpopular in your opinion?
Well, if there's any tax that the legislature might consider, it would be that one. But there is a really strong...
I think there's some support for it. The problem for us is that with tobacco revenues declining and tobacco use declining, you're building this whole thing on a foundation of sand.
That's actually a very good point. But I didn't want to interrupt you. I just want to go through. We have viewers out there and make sure they clearly understand. Okay, now go to the medical liability component of this.
Well, back in 2003, Governor Rendell and the legislature passed a 25-cent tax increase on tobacco, on cigarettes, and set that aside to fund what is called the M-Care abatement program. That is for physicians that they receive some abatement on their medical liability costs that they pay into a state fund called the M-Care Fund. That program is set to expire at the end of this month, and legislation is pending before the legislature to extend that. Right. However, the governor has said, I want my new health care plan enacted, and legislative leaders in the House have said, gee, we're only going to extend the M-Care program for a period of 6 months unless the governor's plan is enacted. Yeah. Now, that legislation seems to be stalled for the year.
Now, let me make sure I understand this. First of all, there's a fund, and money's put into the fund in sort of a Medigap coverage for doctors, to help them cover their insurance for medical liability, right?
The law requires doctors to carry $1 million in insurance.
Okay.
And the first $500,000 comes from the private sector, and then the second $1,000 comes from this fund that was created back in 1975, Terry. And hospitals and doctors and nursing homes pay into this fund a fee.
And this was necessitated because of the rapidly rising rates for coverage, for medical liability coverage for all of the physicians that we go to.
It was a solution offered back in 1975 when the first medical liability crisis hit Pennsylvania.
Okay, we're going to take a quick break. We're trying to make this understandable to you. It's complicated, but it's very, very important. So could have a huge impact on everybody's health care, not just the people who have coverage now, but potentially people who don't have the coverage, which is what this program is aimed at. We'll be back in a moment, and we'll continue with this discussion with my 2 guests.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. We're talking about Governor Rendell's efforts to cover another 800,000 people. All right, Jim Redmond, look, the governor wants to cover it doing the first the tax, now using the M-Care fund. But are there other ways to do this? I mean, what are the options out there?
Yeah, what's interesting in the current debate, Terry, is that most of the focus is about how to pay for it. There's been little discussion about pay for what. And there are two different views that I see in the legislature. One is in terms of we can expand government programs, or we can provide some sort of incentives for small businesses. But there are some things that Pennsylvania has done that could be built on, such as we've moved toward certainly the CHIP program for children and covering low income. And
there's still lots of kids out there that, for whatever reason, haven't even signed up.
But the enrollments are up.
Is up.
And the second is Pennsylvania created the Adult Basic Program using the tobacco settlement funds. That particular program is geared toward low-income working adults and has a waiting list. Jeez. And one way is to expand.
So what you're saying basically is, no, we don't need. Maybe we ought to be looking at what we have now and just expanding that without. That's one way.
That would be my suggestion.
Yeah. Now, a couple of weeks ago, we had former Governor Thornburg in here who talked about lawsuit abuse. Give us a quick update about what's going on in that area.
First off, we're continuing to push that. And, of course, there is clearly a tie into the health care side, because the M-Care that we talked about, one of the reasons that that's out there is because we have not effectively done the things we need to do in terms of legal reform. And it hurts business twice. One, it brings businesses into lawsuits where they shouldn't be. And two, it impacts our ability and accessibility to pay for affordable health care. Clearly, we're continuing to push that. We're continuing to make these kinds of common sense reforms because they impact businesses' ability to create jobs and the health care side's ability to provide affordable, accessible health care.
Now, Jim, what is it that specifically, if you, in your perfect world, that you would like to see the legislature do?
Well, the number one issue that we, along with the business community, agree on is reform of the joint and several liability law. That's the law that says that in cases where there are multiple defendants, you can be responsible regardless of your degree of fault.
So that's at 10%. You could be, the analogy that's often used, you could have 10% involvement in something because you have what they call the deep pocket. Yeah, or less. That's just the analogy. All right, we have about 30 seconds up. And prospects on the tort reform side, medical liability. Go ahead.
Well, we're continuing to push. I mean, unfortunately, Governor Rendell, even though he said as candidate that he would sign the bill, vetoed the exact bill we put on his desk. So we've got to continue to do work to let people know what the real cost impact is to them in their daily lives.
All right, as always, a great update. Thanks. We'll have you back in a couple of months and do a quick update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.